in terms of client service. You know, you need good administration, hospital management. People complain not just about the kind of health they receive, you know, quality of drugs and all that, but you talk about the whole quality along the patient's journey. If a patient is coming in, the kind of nurses we have, how do they take care of patients? Do they make you, you know, feel at home and all that? So it's open to a lot of collaboration. What about leadership? I even belong to, you know, I'm an international member of the American healthcare leadership, you know, and I know that most of the time I come for conferences, we're talking about, you know, healthcare as a business. So that's what they teach. So we're saying people who are also into that, you know, we have consultants, people who do trainings. You can also come home and train people and give them a sense of direction. If people can see their career growing in healthcare, probably they will not, you know, leave. Another major issue we have is medical tourism. And most of the time I've said, no matter how much we cry about it, medical tourism is not going to stop. America, as much as the healthcare system in America is so developed, but Americans live here to go and look for healthcare outside. I know people who go to Dominican Republics. I have friends who are Americans, they even go to India. At least I've met some people in India. So it's not going to stop. What we can do is to build our own healthcare system so that people will come to Nigeria for tourism. Nigeria is big. You have, at least even if we don't come from America, Ghana, Kenya, Cameroon, all the other neighboring African countries can also come to Nigeria to seek healthcare. But the only way they can do it is if we grow our own healthcare system. Another issue that we complain, yes, we'll talk about the infrastructure. We have very weak infrastructure, almost comatose, as is well publicized. You know, you talk about healthcare, so what kind of healthcare are we getting? But I tell you, haven't been in the Nigerian healthcare system. What we need to do is not much as waiting for government to do something. It's something that me and you can change. And when I participate in things outside here, I said, if you look around here, you know, private sector has actually helped economies, and we can grow it. The changes that the healthcare system is not something the government is going to do. I always give an example of the Nollywood. It wasn't government that did it for them. So, and once we have our doctors, once we have keen collaborators, once we can get our health system function, not creating trouble. She said something about mission, because we're always fighting about this mission thing. I have always said, I am an antagonist, I am a protagonist, right, of that mission. Because I tell him, I say, you're not back home, I am back home, and I tell you that it has created more problem for us than men. You do not come, anyway, we'll go into that later, but please, we need a lot of collaboration. A lot. People can come in there and set up business. The healthcare landscape has changed. If you're in IT, I tell you there's so many things they can do right now. People are creating apps. I work in that sector, and I tell you what IT is doing for us. The fact that mobile phone is everywhere is even one step. When Bill Gates came and he talked about what people can do in healthcare, I mean, that was amazing. And he said he is also somebody who is into telemedicine. And there's a lot of it. I went to Virginia, to the School of Telemedicine, and I saw how rural America, you know, how people are sitting there in the office and communicating with people in rural Virginia. That's what we use. And we can use that in Nigeria too. So it's opened, and there's so much to do. Financing has changed. I talk about health insurance, and people say, oh, you mean there's health insurance in Nigeria? That's ridiculous. There's health insurance. People now pay health insurance world over. Healthcare financing, everything that you talk about in healthcare financing is about health insurance. WHO has even said it. Fee for service cannot work, especially in developing countries, whereby we're still fighting for equity in healthcare, quality of care. Out-of-pocket payment is killing people. It's out-of-pocket payment that people sell their land and sell all sorts of things just to make sure that somebody gets well. But then, they always do it at the very last minute, which is why, you know, I keep on talking about the impact of medical tourism. So all this is interrelated. If we have a good system, a working system that is integrated, because why people go to India, they go to India for maybe renal, not dialysis this time, now Nigeria has dialysis centers, but transplant and all of that. Because somebody has high blood pressure, and you don't even know that they have high blood pressure. The person is a walking bomb. Before you know it, the kidney collapses. And so it's at that time that Nigerians now begin to want to, save the person. But we're saying that from the primary level, if people buy health insurance, which is what the government has done, by the way, you have the public sector and you have that for the private sector. So, like you have Medicaid here and all that, the government has NHIS in Nigeria, so everybody can get registered. Then we also have employer-based health insurance that people can key into. And aside from that, you also have you have the retail ones, you have the private ones you can do for your family. So we're encouraging everybody, we're hoping that through healthcare finance and health insurance, which is the celebrated healthcare financing, even with WHO, meaning that everybody, it will make healthcare more equitable. Everybody can have a plan that covers at least the basic benefits in healthcare. You have the basic one, which is also, the primary health, the day-to-day healthcare visits. So with that, everybody is covered. More money is being pulled into the healthcare system. And then, the infrastructure and all those things that we worry about, the challenges we have in healthcare system can be resolved. So, having said that, we're looking for more collaboration. People should put more value, because whether you're here or in Nigeria, wherever you are, you have relations, we have children. Like Nelson said, you're going to come back one day, and then nobody ever prays. Nobody knows. You don't even know you're going to be sick. So we need to do something about that. Health is wealth, and I want to encourage everybody to key in. There's so many things to do. There's business. I'm not telling you to come and then, I'm telling you, invest in healthcare, because right now there's a lot of potential. It's virgin ground for investment. If you're a nurse, there's a lot you can do. If you're what about drugs, diagnostics? And before I end, I want to tell us, please take it serious, because what I see, and I'm not happy about, is that the Indians, the Chinese, they're gradually taking over our healthcare system, where they're coming to invest in Nigeria. Most of the very good hospitals are Indian. Indians, they're not doctors. You don't have to be a doctor. They're not doctors. They just come, build a hospital, and then go and bring the other Indian doctors and then some Nigerian doctors to run it. Most of you must have heard of Mekure. Mekure started in Lagos. They're in Ogun, they're in Ibadan, they're everywhere, they're nowhere. It's a diagnostic center. It's owned by the Indians. So there's a lot of opportunity, and it would be nice that we that are directly involved, we have families and are able to key in and use that business opportunity to also grow the healthcare system. Thank you.
Thank you, panelists. The value of Nigerian health system and its consequences. What's the role of the aspirants in improving the healthcare system in our country? That's why we're having this discussion. The value of the healthcare system in Nigeria. And our two panelists have shed light. The second speaker said it's a vast abyss of which topic do we choose? Health is about life. Health is about life. A lot of us, before we go to Nigeria, not only do we say our prayers, we go and see our physician, have our vaccinations done. Okay, I'm being told that the Consulate General from Atlanta has just walked in. Sir, you're welcome. You've missed quite a few, including our vegan lunch this afternoon. But you're truly welcome. And we're now on page 6, Your Excellency, and we're discussing the value of the Nigerian health system and its consequences. Do we have contributors from the floor? We have a gentleman there with his hand raised. Thank you.
Okay. Hello. My one is observational questions. you talk about healthcare in Nigeria, and I think one of the areas you talk about out-of-pocket payment. Now, I teach ethics, and I don't know whether it's rumors or truth, but I've heard that too many to be a rumor, that when somebody goes to the hospital in Nigeria and they're not able to pay their bills, they are actually detained in the hospital. If that is true, I don't know whether, I hope it's not true, but if that's true, what can you guys, knowing the way it is done in the US, can you do using the diaspora movement to help address that issue? That is not accepted, it's a human rights violation, that people should be detained because they're not able to pay their bills. And some of the rumors is that some people might have died out of the situation. So have you heard of something like that, or just rumors, and what would you do? Thank you.
Yeah, I just wanted to add to that that's not a rumor, it's a fact. So it's human rights issue, and I don't know anywhere on this planet where anyone is detained at a hospital because he couldn't pay their bills. So I think it's probably a governmental, response. It wouldn't be because you guys are in private sector, but how is that happening to people who are not? I always wonder, can't people just walk away from the hospital? They would chase them and handcuff them and lock them up. It's just crazy.
I think it's the other way around. If you don't have the funds